My name is Ritu Kamal, and as Luke said, I'm a Stanford India Biodesign Fellow, which is basically a program in which my team and I build low-cost medical devices. And we do that with the idea that you shouldn't you shouldn't bring things that are designed for another setting to a new setting and then expect them to work as if, successfully. So we design with India in mind, with the unmet Indian clinical needs in mind, and so innovation in health, and that's what I want to talk to you about today. So innovation has become this big buzzword in India's growth story. We're living India's growth story here. So we know these things. We know our great GDP numbers. We know how well we compare to our peer economies, the other BRIC countries, the emerging countries. What we often don't see is how some of our other indicators, such as infant mortality rates, maternal mortality rates, really don't compare to everybody else. In healthcare indicators like these, India is closer to sub-Saharan African countries rather than to the rest of the developing world that's galloping ahead. But that's not to say that India doesn't innovate. We have scores of Harvard Business Review articles that talk about things like the Arvind Eye Care system that takes high throughput, high quality to a whole other level. They do eye surgeries that are low cost and they do millions a year. And then devices that were built in India, like the handheld ultrasound that GE created a couple of years ago, which is portable and rugged and can go anywhere and is really quite a marvel. And then, of course, our pharmaceutical industry, which supplies, for example, antiretrovirals for HIV-positive patients across the world. And today, in the morning, we heard about Embrace, which is also this technological marvel. And these are the kinds of things that innovators like myself and my team, we draw inspiration from. So, as I mentioned earlier, I work in the area of maternal and child health, and these are the things that I feel most passionately about. And I want to share with you two stories, fairly different, of new ideas in healthcare, and then close with that. So to start with, I'm working currently on this need, which is birth asphyxia. Birth asphyxia, simply defined, means when a baby is born, it doesn't cry. And this can be for a variety of reasons. Blocked airways, some other disease state, et cetera. But the point is that close to 1 million babies die every year from birth asphyxia. And it's very easily preventable. Basically, since it can't breathe, you need to push air into the lungs of the baby, and this is what resuscitation is. So if you can get skilled attendants and if you can get the correct equipment, you can do resuscitation. You can save babies' lives. So what my team and I are working on currently is building a resuscitation equipment that suits Indian settings, that's easy to use, that's easy to clean, because infection rates are something that are a big problem with us in India, and also is easy to train people on. Now, this is very much a work in progress, and we're finding new things as we go along. For example, the masks that we use in babies' faces are actually designed for adults. And they don't fit. So the air that you're pumping in actually leaks out of the sides, which is not useful. So these are the small things that we're talking to people in the field and going out and figuring out how do you build a better resuscitation device. So that's a very technological example. I also, as mentioned earlier, worked in South Africa for over a year. And from there, I want to bring you a story that is perhaps not as technological, but equally important in the pursuit of better healthcare. So in South Africa, these are some of the women I worked with there. 1 in every 3 women who is pregnant is HIV positive. And if you're going to think about preventing transmission of HIV, you really have to think about how do you stop these pregnant women from passing on the virus to their babies. And the kicker is, it's possible, it's very doable, it gets done every day in the developing world. Less than 1% of HIV positive pregnant women in the developing world pass the virus on to their babies, but this is not true, obviously, in poorer countries. So the group that I worked with, basically we thought, well, to start with, you have to let people know that this is possible, that women don't have to assume that the virus has to get passed on to their baby. So we started with a partnership. So the organization that I worked with, Mothers to Mothers, teamed up with a soap opera. So Luke, to your point, not every soap opera or a reality TV show is necessarily doing the fungal thing to brains. This hugely popular soap opera in South Africa called Soul City basically said that, okay, we'll take this one season and we'll make our the main actor in that season be a HIV-positive pregnant woman, and then sort of follow her story as she finds out that she's HIV positive. This is where she goes for help. This is who she calls for help. And then with that, we basically set up, my group basically set up a call center where we leveraged the fact that everybody in South Africa has a mobile phone, just like everybody in India has a mobile phone, and they can call in. And because of the stigma attached to HIV, people prefer to call in anonymously to find information. And basically what we were able to do is pass on the message, well, yes, prevention of HIV is possible in mother-to-child transmission. And we were able to connect women to unbiased sources of information, not traditional medicine or something that tells them biased facts. And then at the last count, Seoul City did some surveys to say that they were able to increase awareness by a great deal. So two very disparate examples of working in maternal health and child health. And this is a picture, I hope this is clear, that always grounds me when I'm thinking about technology and I'm thinking about innovation. There are these two women very intently looking after the baby that's just been born. And in the background, if you can see, there's this giant piece of equipment. I don't know the last time it was used. It might not have ever been used since it was bought. So for people like me who are working in technology, this serves as grounding. Technology is not the answer. Technology is not what is going to solve everything. And we heard earlier, awareness is not the answer alone as well. So what we basically need, if we are going to make any inroads in any dents in the magnitude of the problem that we have in India in terms of healthcare, what we need is engagement on a large scale. We need the filmmakers and the thinkers and the actors and the public intellectuals and the writers and civil society as in general to engage with healthcare, engage with the problem of maternal and child health, in my dream world, as much as we engage with cricket. And really think about novel ways, innovative ways, not just about technology, not just about awareness, but different ways of how do we solve this enormous problem that is causing more than 60,000 women to die every year in India in childbirth, which should be a happy occasion and not really a disease burden. So with that, thank you very much for your time.